Every few minutes, another older adult in the United States is diagnosed with memory decline. What truly worries geriatric doctors is not just that number, but what lies behind it. In many cases, dementia does not begin with genetics, and it is not an inevitable consequence of aging. It begins much more quietly, with familiar pills that you may be taking every single day. In recent years of clinical practice, more and more doctors have noticed a troubling pattern. Older adults continue their daily lives normally, no stroke, no head injury. Yet their memory declines rapidly. They forget familiar names, conversations become confusing, the mind feels cloudy in the evening. And when doctors review medical records, the common factor is not diet or exercise. It is the list of medications taken for many years, without ever being carefully reviewed. Many people believe that if a medication is prescribed by a doctor or sold openly at the pharmacy, it must be safe. But geriatric medicine has revealed a very different truth. After the age of 60, the brain becomes far more sensitive to substances that affect the nervous system. Medications that were well tolerated at a younger age can now quietly disrupt memory, cause confusion, and impair thinking. Large studies in the United States show that certain common medication groups can significantly increase the risk of memory decline when used long-term. The most dangerous part is that this effect does not happen overnight. It accumulates slowly. Each pill seems harmless, but over time, the brain loses its ability to compensate as it once did. In this video, I will point out the most common medication groups linked to memory decline in people over 60. More importantly, I will help you understand why this happens and what you can do to protect your brain safely, without panic and without stopping medications on your own. If this is your first time watching our channel, please subscribe. We share health knowledge specifically for older adults that is rarely explained clearly elsewhere. And now, let us begin with the most fundamental truth that many people have overlooked. Type 1. Statins, when heart protection becomes more complex for the brain. Many people over 60 take statins with great confidence. These drugs lower cholesterol, protect the heart, and reduce stroke risk. And in many cases, this is true. Statins have saved countless lives. But what is rarely explained is that the aging brain does not respond to statins the same way the cardiovascular system does. The brain is largely made of fat. Cholesterol is not just something that clogs arteries. It is a building block for nerve cell membranes and protective nerve coverings. When cholesterol drops too low, especially in very old adults, the brain may struggle to maintain efficient signal transmission. In clinical practice, some older patients report specific symptoms after long-term or high-dose statin use. Not severe dementia at first, but reduced sharpness, difficulty recalling familiar names, losing track during conversation, trouble focusing when reading or watching television. Many describe this as brain fog. It is important to be clear. Not everyone who takes statins experiences this. Many people tolerate them well for years. But in a sensitive subgroup, especially those without a history of major cardiovascular events, the balance between heart benefit and brain risk deserves careful reevaluation. Another lesser-known point is that not all statins are the same. Some cross the blood-brain barrier more easily, potentially increasing cognitive effects in older adults. When memory changes coincide with dose increases or medication switches, this should not be ignored. The message is not to stop statins. The message is to ask the right questions. Is this dose still appropriate for my age? Do I need the same cholesterol target as when I was younger? Is there a more balanced option for both heart and brain? These are reasonable discussions with your doctor. Now, let us move on to another familiar group. Medications many older adults take at night to sleep better, or during allergy season, without realizing they directly suppress the brain's memory system. Type number 2. Sleep aids and nighttime allergy medications. The silent enemy of memory. There is a type of medication that many people over the age of 60 take every day without realizing it belongs to one of the highest risk groups for memory. What makes this especially concerning is that these drugs are often not prescribed for depression. They are prescribed for nerve pain, for insomnia, for chronic pain. And because of that, many people never feel the need to be cautious. This group includes older generation antidepressants, with amitriptyline being a common example. For many years, this medication was considered effective because it helped people sleep more deeply and reduced pain. But modern geriatric medicine now views it very differently. Amitriptyline has a strong anticholinergic effect, and acetylcholine is the very foundation of memory and concentration. In younger adults, the brain still has enough reserve to compensate, but in people over the age of 60, natural acetylcholine levels have already declined significantly. When a medication continues to suppress this system day after day, the brain operates in a state of ongoing deficiency. The result is weaker short-term memory, slower thinking, increased confusion during conversations, and waking up in the morning with a heavy head even after a full night of sleep. Another dangerous aspect is that this medication is often taken in the evening. People fall asleep faster and assume the drug is helping them. But during the day, they feel sluggish, less focused, more forgetful, and they rarely connect these daytime symptoms to the pill they took the night before. In clinical practice in the United States, amitriptyline is listed among medications that should be avoided in older adults when safer, brain-friendly alternatives are available. Yet because of long-standing prescribing habits, many people continue using it for years without a proper review. If you or a loved one is taking medication for nerve pain, insomnia, or chronic pain, and has recently noticed worsening memory, this is an important point to discuss with your doctor. Not to stop the medication on your own, but to ask whether there is an option that has less impact on memory. If you find this information helpful, please follow and subscribe to the channel. We focus on sharing health warnings specifically for older adults, the kind many people only discover when it is already too late. And next, we will talk about the most familiar group of medications of all, drugs that many people believe are protecting the heart. But for the aging brain, the story is not that simple. Medication burden and the opportunity for recovery when detected early. The most dangerous part of everything we have discussed does not lie in any single pill. It lies in the cumulative burden that the aging brain carries every day. When multiple medications act at the same time on critical brain systems, especially the acetylcholine system and the centers that regulate thinking and awareness, the brain does not just slow down temporarily. It begins to change how it functions. In many cases, doctors observe that the brains of older adults taking multiple medications show symptoms that closely resemble dementia. Memory weakens, focus declines, thinking becomes slower. But there is a crucial difference. This is not always permanent damage. In many cases, the brain is under prolonged suppression. When nerve signaling is blocked from several directions at once, brain cells do not receive enough stimulation to maintain their connections. Areas responsible for memory and alertness gradually become less active. However, if the cause is identified early, before those connections are completely lost, the brain still has a significant capacity to recover. In real clinical practice, many older adults have shown clear improvement after a proper medication review. As the overall medication burden is gradually reduced, unnecessary drugs are removed, or safer alternatives for the brain are introduced, patients begin to notice real changes. Their thinking feels clearer, concentration becomes easier, memory improves step by step, mental energy begins to return. What matters most is that this process must be done carefully, step by step, with medical supervision, never on your own, never in a rush. This is not a battle against medication. It is a journey to return medication to its rightful role, supporting the body, not harming the brain. The final message I want you to remember is this. Memory decline is not always an unavoidable destiny. In many cases, it begins with factors that can be adjusted if you are early enough to ask the right questions and take action. And knowledge is the most powerful tool you have to protect your brain. Type number 3, proton pump inhibitor stomach medications. When the stomach feels better but the brain quietly weakens. Many people over the age of 60 begin taking proton pump inhibitor stomach medications for very simple reasons. Heartburn, acid reflux, bloating, difficulty sleeping because the stomach feels irritated at night. These medications bring fast relief. And because the effect is clear, many people into taking them month after month, year after year, without ever realizing that they may be affecting the brain. Proton pump inhibitors work by strongly reducing stomach acid. This helps relieve symptoms, but it also creates a major problem that is rarely explained clearly. Stomach acid does more than cause discomfort. It is essential for absorbing certain key nutrients, especially vitamin B12. Vitamin B12 plays a critical role in protecting nerves, maintaining memory, and preserving mental clarity. When vitamin B12 deficiency lasts for a long time, nerve cells are not properly nourished. People begin to notice slower thinking, increased forgetfulness, confusion, tingling or numbness in the hands and feet. Walking becomes less steady than before. Many assume this is simply aging, but in reality, it can be a medication-related nutritional deficiency. Large observational studies in older adults in the United States have shown that long-term users of proton pump inhibitors have a significantly higher rate of vitamin B12 deficiency. When this deficiency continues for many years, the risk of cognitive decline increases quietly and gradually. What makes this more concerning is that many people do not actually need to stay on these medications for such a long time. Proton pump inhibitors were originally designed for short-term treatment, but when the medication is stopped, symptoms often return, leading people to continue using it without a reassessment of the underlying cause. The solution is not to stop the medication on your own. The right step is to talk with your doctor. The dose may be reduced. A milder alternative may be considered. Vitamin B12 levels can be evaluated. Even a small adjustment can make a meaningful difference for memory and mental alertness. And now, we move on to another group of medications. Drugs commonly prescribed for anxiety and insomnia. They help you feel calmer, but when used long-term, they can slowly make the brain less sharp over time. Type number 4. Benzodiazepine sedatives. Calm at the cost of memory. There are pills that make you feel relief almost immediately. Anxiety eases. Sleep comes faster. The mind feels less tense. For many people over the age of 60, these medications feel like a lifeline. But the price paid for that calm is sometimes memory and mental sharpness. Benzodiazepine sedatives are commonly prescribed for anxiety, prolonged stress, and insomnia. They work by increasing the effect of GABA, a chemical that calms brain activity. In the short term, this can feel comforting, but with long-term use, the brain begins to adapt in a harmful way. In older adults, keeping the brain in a mildly sedated state every day reduces the ability to form new memories. The brain becomes less flexible. Information processing slows down. Many people describe feeling foggy, detached, and disconnected from what is happening around them. Long-term studies in the United States show that people over the age of 60 who use benzodiazepines for more than 3 months have a significantly higher risk of cognitive decline compared to those who do not use them. Long-acting versions that stay in the body longer increase the risk of accumulation over time. What is especially concerning is that these changes do not affect memory alone. Families often notice that their loved one becomes less emotionally responsive, less interactive, less interested in activities they once enjoyed. Personality seems to change, and when patients try to stop the medication, anxiety rebounds sharply, and sleep becomes worse, leading them to believe they cannot live without the drug. One point must be emphasized clearly. Benzodiazepines should never be stopped suddenly. This can be dangerous, but long-term use should also not be accepted without regular review. Today, there are safer options for older adults, including medications with less impact on memory and proven non-drug approaches. And next, we will discuss the most dangerous factor of all, yet the one least talked about. Not a single pill, but the way multiple medications combine and quietly accelerate memory decline without anyone noticing. How the brain quietly changes with long-term medication use. The most dangerous part of medication-related memory decline is not how severe it becomes. It is how it begins. Very slowly, very familiar, and almost identical to what we commonly call normal aging. When a medication affects the brain over a long period of time, it rarely causes a dramatic event. There is no sharp pain, no sudden moment when you clearly realize that something is wrong with your brain. Instead, the brain gradually becomes less flexible. Information processing slows down. Concentration weakens. Remembering new details becomes harder than before. After the age of 60, the brain has already gone through natural aging. The number of connections between nerve cells slowly decreases over time. When medications further interfere with these sensitive systems, especially drugs that affect neurotransmitters such as acetylcholine or gamma-aminobutyric acid, the brain loses its already limited ability to compensate. At first, the signs are subtle. You notice that you need more time to think. You pause mid-sentence while speaking, as if your mind briefly freezes. You watch a familiar program but struggle to follow the storyline. In the evening, your mind feels foggier than in the morning. Many people describe this sensation as if a thin mist has settled over their thoughts. The problem is that these changes happen so gradually that you adapt to them. You start writing more notes. You rely on your phone more often. You avoid long conversations because they feel mentally exhausting. And over time, you convince yourself that it is just aging. But in real clinical practice, geriatric specialists see something very clear. When medications are the cause, the brain regions responsible for memory and attention are not permanently damaged right away. They are suppressed, slowed down, gradually muted. Because of this, if the problem is not recognized early, many people are mistakenly diagnosed with age-related dementia. The key point you need to remember is this: the brain does not weaken overnight, and when the cause comes from medication, adjusting things at the right time can make a significant difference. But to do that, you need to know exactly which medications are most likely to trigger this quiet chain of changes. And that is why we now need to talk about the first group of medications that many older adults are taking without realizing the risk. When multiple medications combine into a hidden threat. What worries geriatric doctors the most is not a single pill. It is the way many medications that seem harmless on their own slowly add up over time. This situation is extremely common in adults over 60. One doctor prescribes one medication, another doctor adds a different one. Each prescription has a reasonable explanation, but very rarely does anyone step back and look at the entire picture. You may be taking a sleeping pill at night, a stomach medication in the morning, a bladder medication during the day, and a pain reliever when needed. Each pill by itself may not cause obvious problems, but when several medications act on the same nervous system at the same time, especially the acetylcholine system, the burden on the brain increases dramatically. The aging brain no longer has the same buffering capacity it once had. When acetylcholine is suppressed from multiple directions, communication between brain cells becomes less efficient. The result is usually a predictable pattern. Short-term memory weakens first, then attention declines. Eventually, processing speed and spatial orientation begin to suffer. What makes this especially dangerous is that the person taking the medications often does not realize this is happening. They are not overdosing. They are not experiencing clear side effects. Instead, each year the mind becomes a little slower. Forgetfulness increases slightly. Confusion appears a bit more often. And by the time family members begin to worry, the medication burden has already accumulated deeply. In medicine, this phenomenon is called medication-related neurological burden. It does not show up on routine blood tests. It does not appear on early brain scans, but it becomes very visible in daily life. The person is less mentally flexible, becomes mentally fatigued more easily, avoids social interaction, and shies away from situations that require sustained thinking. The most important thing to understand is this: many cases of rapid memory decline are not caused by a new disease suddenly appearing. They happen because the brain has been under prolonged medication pressure for too long. The good news is that when this problem is recognized, careful step-by-step adjustment, reducing unnecessary medications or replacing them with safer alternatives for the brain, can lead to meaningful improvement in brain function. And to truly understand this process, we need to begin with the first group of medications that many older adults take every night, believing they help with sleep, while in reality, they may be quietly weakening memory day by day. Practical and safe solutions to protect your memory. If you are feeling worried and asking yourself, "So what should I do now?" the most important thing I want you to hear clearly is this: do not stop your medication on your own. Do not panic. And do not assume that memory decline is something that cannot be reversed. In many cases, what makes the biggest difference is not adding a new drug, but taking a careful look at what you are already taking. After the age of 60, the brain no longer tolerates medications the way it once did. That does not mean medications are wrong. It simply means your body has changed. Because of that, the first and safest step to protect memory is very specific and very practical. Review your entire medication list with your doctor or your pharmacist. Bring a complete list, not only prescription drugs, but also over-the-counter medications, sleep aids, allergy pills, stomach medications, pain relievers, even vitamins and herbal supplements. Many effects on the brain come from the combined burden, not from a single pill. When a doctor looks at each medication separately, the problem can be missed. But when the full picture is reviewed, everything looks very different. The second thing you need to do is listen closely to small changes in yourself. Do not wait until memory loss becomes severe. Pay attention if your thinking feels foggier in the evening, if forgetfulness increases after starting a new medication, if you feel more confused during conversations. These signals matter. They help your doctor make adjustments early, before deeper damage occurs. The third step is to ask the right questions. Do not only ask, "Do I need this medication?" Ask, "Does this medication affect memory in people over 60? Is there a safer option for the brain? Is this dose still appropriate for my age?" These are reasonable and important questions. Your goal is not to stop all medications. Your goal is to use the right medication, at the right dose, at the right time, in a way that fits the brain you have today. When this is done properly, many older adults notice clear improvement, better memory, clearer thinking, sharper mental energy within just a few months of careful adjustment. This is the foundation. Before we talk about individual medications, you need to understand this. Protecting your memory begins with how you review your own medication list. Do not let your memory fade away in silence. After the age of 60, the most valuable thing is not just living longer, but living with a clear and alert mind. Memory does not disappear overnight. It slips away little by little, through small changes that many people gradually get used to ignoring. And in many cases, the cause is not aging, not fate, but familiar medications that have never been properly reviewed. The most important thing I want you to remember today is this. You do not need to be afraid of medication, but you do need to understand it. Understand that your body is not the same as it was before, and what worked 10 years ago may no longer be suitable for your brain today. If after watching this video, you begin to ask more questions during your medical visits, take a closer look at the medications you are taking, or start protecting your memory earlier, then you are already far ahead of many others. If this is the first time you are watching our video, please subscribe. We share health knowledge for older adults that is rarely explained clearly anywhere else.